there's a lot of consolidation going on in the healthcare industry. It's going to speed up even more if that's possible. We've seen hospitals merging. We've seen hospitals acquiring physician groups, outpatient facilities, insurers acquiring hospitals, outpatient facilities, and physician groups merging. All of those trends and all of those consolidations also are being reviewed by the antitrust enforcement agencies. And when I refer to antitrust enforcement agencies, I'm including the Federal Trade Commission, the Antitrust Division of the U.S. Department of Justice, and the various state antitrust sections throughout the country, including Ohio, which has a very active state antitrust section and a special interest in health care. Chairman Leibowitz, among other things, says, anti-competitive mergers and conduct in healthcare markets can hurt consumers. Many recent FTC merger enforcement actions have involved companies that provide healthcare services, such as dialysis clinics or testing labs. In particular, the FTC is working to prevent hospital mergers that may leave insufficient local options for inpatient services. This quote is, experience demonstrates that hospital consolidation results in higher prices for medical services and higher healthcare costs for consumers and employers. That was a recent comment by the president and CEO of AHIP, America's Health Insurance Providers, or Plans, rather. And that statement was made as AHIP filed its amicus brief in support of the Federal Trade Commission in the Sixth Circuit in the case involving ProMedica. The FTC had challenged ProMedica's attempt or their actual acquisition of St. Luke's in the Toledo area, and the FTC has been successful so far. The federal agencies, just in the past 12 months have especially been active in the consolidation area involving healthcare. It has involved, in addition to ProMedica, there have been other investigations and challenges in consolidations impacting inpatient services and specialty services, outpatient dialysis services, or in clinics, inpatient psychiatric services, hospitals acquiring the two largest adult cardiology groups in Reno, Nevada. There have been investigations and announced challenges by the FTC, and in some cases the state attorney generals have joined in these investigations and challenges. One example is in Pennsylvania, where the FTC and the Pennsylvania antitrust section investigated a proposed consolidation of two hospitals, and they announced a challenge of that as it would adversely affect inpatient services according to their perception, and that was abandoned. Ohio's antitrust section joined with the FTC in their filing of the federal lawsuit for a preliminary injunction against ProMedica. So in many cases, these investigations and sometimes ultimate challenges are really in combination between the federal agencies and the state agencies.